This webcast is a proposal for a rapid, low-cost end to the coronavirus crisis with relatively low numbers of casualties. It is concerning that the simple solution presented here has not been discussed, and that we may be in a process which at worst may wreck Western civilization or at least lead to a decade of austerity. And all because of a panic over a new form of the common cold. The strategy which will be presented here can be applied to any country, region or town, but here will be described for the case of the United Kingdom. If the coronavirus epidemic, which was expanding in the UK in March, had been allowed to run its course without attempts to slow it, it would have plateaued for about a month, probably in April, and then declined after a population had achieved herd immunity. This would have required about two-thirds of the population to be infected, with about 220,000 deaths from COVID-19, and with twice that number requiring intensive care. Now, 440,000 intensive care cases over a month would have overwhelmed the National Health Service in the UK. At the prospect of this happening, the Prime Minister, Boris Johnson, decided to impose a lockdown to slow the rate of infection so the number of casualties would be manageable. And this has succeeded because the number of deaths, which is about 800 a day, for which there are enough hospital beds. The problem is that to achieve herd immunity at this rate would take about 9 months. Like General von Mogt, who got cold feet implementing the Schlieffen Plan and so condemned his country to years of suffering, Boris Johnson, instead of a short, sharp shock, has chosen a lingering pain and damage of a lockdown. To continue the analogy, once the Schlieffen Plan was abandoned, there was, in effect, no plan, and that is the case now. There is no planned date for the end of the lockdown because the epidemic will re-expand once controls are lifted. So controls are going to have to be continued until a medical cure appears or herd immunity is obtained. Unlike the Schlieffen Plan, the Pelling Plan, so to speak, can be enacted at any time, with far fewer casualties than the original plan for herd immunity. And this is what I would propose. Experience in East Asia shows that a lot of restrictions are necessary to suppress the disease, and this is probably not politically viable in the UK. To attempt to stop the epidemic without achieving herd immunity will mean strong controls, especially border controls, indefinitely, with incalculable effects on the economy and society, and even on the climate, considering the global dimming effects. Herd immunity is the essential biological tool to stop the epidemic. To explain the significance of herd immunity, imagine that each infected person himself infects on average 3 other people, on average 7 days later, which seems to be the case for the coronavirus disease. Then the number of new infected people will expand by a factor of 3 each week. Now, if of those 3 other people, 2 happen to be immune, then the epidemic will expand by a factor of 1 only each week, because only 1 person instead of 3 would catch it from the infected person. So thus, if two-thirds of the population were immune, the epidemic would stay at the same level, and if more than 2/3 were immune, then the epidemic would decline and die out. Now, 2/3 of the population of the UK is 44 million, and if the infection fatality rate is 0.5%, then the number of deaths to achieve herd immunity would be 0.5% of 44 million, which is 222,000. So this theoretical scenario is where this number of 220,000 comes from. and which gave the decision makers in Downing Street cold feet in March. This number is based on certain assumptions which may not be exact, and so is a ballpark figure. This does not matter for the broad argument presented here. The plan proposed here is to carefully choose the 2/3 of the population you need to be infected to obtain herd immunity in such a way that they are healthy people who would not die from the infection. If all the people who might die were prevented from catching COVID-19, then herd immunity would be achieved with no deaths at all. The remarkable fact about COVID-19 is that 98 to 99% of those who die from the disease have a dangerous pre-existing chronic health condition already. So you protect those with health conditions and let the healthy catch the disease and thus achieve herd immunity for society as a whole. Now, in the case of New York City, about 2.6% of those who die have no underlying health condition. So, if those 200, so that you can multiply this 220,000 deaths, which is the postulate with no controls. But if we only allowed those with good health to be infected, then only 2.6% of those 220,000 would die, and that's about 5,700. We can compare this with the total number of deaths of COVID-19 so far in the UK by April the 24th, which is about 20,000. We can also compare with the number of deaths in the United States from flu in the winter of 2018, which was 80,000. Could this plan be implemented? I would say pretty easily, because those with pre-existing health conditions are already under medical direction, and so extra precautions and behaviour would be a lot more complied with. Instead of locking down the entire population, only 10 to 20% would need to be protected. The degree of protection could be calibrated to the risk of each individual, which could easily be calculated. Most at risk are the elderly and obese, and are thus less likely to be economically active, and so there will be less disruption to the economy, if any. Because the number of deaths will be much lower, herd immunity could be achieved in a much shorter time, in as little as 1 month. Distancing and hygiene controls may need to be reimposed to speed up the winding down of the epidemic, so that controls can be fully lifted sooner. A population with herd immunity will be protected even if infected individuals come in from abroad, so border controls will be not necessary. I believe that this argument proposed here is so compelling that it must be very seriously and urgently considered and possibly implemented immediately.